All right, guys, so we're going to go through a mobility assessment for our CrossFit athlete here. So first one we're looking at with Matt here is just your overhead squat. So we get a good assessment of thoracic spine mobility, hip mobility, and ankle dorsiflexion. So you get a lot of bang for your buck with that assessment there. Here I'm looking at his ability to load into his, with an anterior lunge, and then also thoracic rotation. So you're getting a feel for thoracic spine again, thoracic spine rotation and extension, and also loading into his hips. And this is just a single leg, more of a strength assessment, whether he's more quad dominant or if he's able to use his posterior chain with that single leg reaching exercise. And this one here is definitely a more functional hip mobility assessment. We call these CARs or capsular articular rotations, and we're just trying to get Matt more fluid with that motion, that ball and socket moving on the hip joint there.
Hey there, Dr. Eric here from Impact Physical Therapy. Wanted to give you a quick snapshot of a treatment session and insight of what we do here at Impact. So we're very hands-on, and we love to do a functional assessment with all our patients. This lady came in with some knee pain, is explaining how her hips are really tight, and she's kind of got a little bit of limp on her right leg there. So one of the things we really invest in with all our patients is a hands-on approach. We love just, getting in and feeling the tissues and mobilizing the tissues, because this stuff called fascia can get kind of sticky, which lines all our muscles and our tissues, and sometimes it can get bound down or what we call congested. So as this lady came in with significant front of the knee pain or anterior knee pain, it was really important for me to get into her tissues and mobilize them, that meaning break those down in order to decrease the congestion in her knee and really get her life back. She really wants to get back to working out and doing lunges.
In this video here, just wanted to introduce you to dry needling and its many benefits in the physical therapy world. So first off, what is dry needling? I always use the term that it's a westernized acupuncture, or it's more of a neuroanatomical approach to utilizing a needle. And then what does dry needling actually do? So three things I explain it as. We're creating a micro lesion and almost jump-starting that inflammatory response. We can also have an effect on trigger points. It's almost a Control-Alt-Delete to a top band or a trigger point. And also you're getting a chemical change, your natural opioid response from the needle entering the system. It's great for acute injuries, promoting healing, and also in chronic injuries to kind of desensitize that pain cycle that you're going through. So in this video, you're seeing the needles going in, you're also seeing the stim unit being used. And last thing I get to hear a lot is, what will you feel? You may experience some soreness for 24, 48 hours following a dry needling session. So that's a great introduction. Thanks, guys.